Hello, I'm Will. I'm the Director of Operations at Transcend Health Solutions. I'm also one of the nurses here, and I do a lot of the consultation calls. And this is Kelly Light, one of the nurses here as well, and she does a number of the consultation calls. We wanted to make a video where we cover all the frequently asked questions that we typically talk to people about in consultation calls. That way, if you just want to watch a video that's more comfortable for you versus talking with one of us, then we can get all the information to you. So I think they often start very differently, but because people come to this with different levels of prior research, they may have either done ketamine treatment before or heard about it from their psychiatrist or a friend. So we just kind of wanted to cover the generalities at our clinic with how things go. So where shall we start?
I think we'll just bounce off each other and think of the most frequent questions that we get. I would say one that people like to start with is just to know a little bit about our intake process and what to expect before they can start KAP.
Right. So for us, a very thorough intake process is really important because when people come to treatment, most of our patients are treatment resistant, meaning they've done medication, they've done therapy, and so for us, it's really important to ensure that their diagnosis is appropriate, that we know how much distress they're in, that we had a really good trauma history associated with all that they've been through. That way we can form a treatment plan and let somebody know about how much treatment we think that they're going to need. So that first intake that we do with patients is they meet with the ketamine-assisted psychotherapist that they're actually going to be working with and get to know them, make sure that they want to work with that person. And we go over all of the need-to-knows about ketamine, what it's like, the whole process, and the therapist, by the end of that visit, will be able to tell someone how much treatment they think they might need, how many sessions, whether they're going to need preparatory sessions or integration sessions. And at the end of that visit, we'll get vital signs, EKG, and someone will leave with a good faith estimate that tells them exactly kind of how much treatment we think they need, how much that's going to cost. So there's no mystery about this whole process, how long it might be, or otherwise. Of course, that's just an estimate. Someone might finish up sooner than later, but generally speaking, the therapist will be able to give a treatment recommendation. The only other aspect of the intake process that there is the medical, which is usually just a quick telehealth appointment with our nurse practitioner. The nurse practitioner just goes over all the medical history that we can establish the ketamine dosing and just clear up any other medical questions that are there. The only other aspects of the intake process that I think are relevant to mention are just that we like to coordinate care with other providers. So we'll usually get releases of information for a person's therapist or psychiatrist and just shoot them an email and say, hey, we're going to initiate treatment. Is there anything that you think is important for us to know that we can be more successful? And just touch bases with them. If they want to talk with us prior to getting started, we can always do that. So that's the intake process. So that I don't run out of breath, do you want to take it from what would be next in the process?
Sure. So if you and the therapist meet and decide that you're ready to start KAP, then the next appointment would be your first KAP session. If it might be indicated that you do more talk therapy on the front end and don't dive right in with the ketamine to start, but again, that would be between you and the therapist. So some people need more prep sessions, especially if you haven't done a lot of therapy in the past, or maybe it's been a while since you've been in active therapy. But if you and the therapist decide you're ready to proceed with ketamine, the next appointment after you did both the intakes would be your first KAP session. So you would come in and one of us nurses would get you set up in the room. You'd get in a comfortable recliner and we start an IV. We hook you up to the monitor, answer any last minute questions you may have and kind of go over what the process is going to be like for that day. And then we step out and the therapist comes in and you have a good amount of time with them before starting the infusion to talk about, what you want to dive into that day, what your intentions are for that particular session, what's come up since the last session that you were in. And then once you're ready, the therapist will get the nurse and we'll come back in the room and we'll start the infusion. So the infusion lasts anywhere from 30 to 45 minutes. We do IV dosing and it's titrated to be individual, to get the perfect therapeutic level for each person. So that's why it can range between 30 to 45 minutes. Everybody's a little bit different in how fast we run the pump because we want you to be able to do active therapy while you're getting the ketamine. So once the infusion is over, we will monitor you for about 15 more minutes, get you disconnected from everything. Then we step out and you have more time with the therapist to process whatever came up during that infusion. And then after that appointment, you do need a ride home, either family or friend, and or an Uber or Lyft, and just kind of take it easy the rest of the day. Don't make any major decisions. Just practice some self-care, journaling, take a walk, take it easy.
Yeah, so that's what a general KP session looks like. Our most common cadence is doing one of those per week. Every now and then we'll go faster or slower than that, but that's usually what our therapists recommend because doing a KP session can be a lot. So doing 2 a week can be too much, too fast for some people. Every now and then we need to go a little bit slower, so that treatment plan is always being adjusted along the way based on how someone's responding and just where things are at in the process. So it's not uncommon as we get through a series of these, which a series averages oftentimes around 6 sessions, but that could be 4 to 6 or 6 to 8, or sort of the max is usually 10 in an initial series for most people before we'd be tapering out. But it's common as we get towards the end of that to start increasing the amount of time in between sessions or tapering those sessions. And a very small amount of people might be indicated for maintenance sessions, which is like a session every 1 to 3 months, more common in chronic pain. And sometimes with certain diagnosis, it can just make sense to do some more sessions in that next calendar year. But most of our patients discharge to standard therapy either with us or with their outside therapist they were already seeing, alongside psychiatry if they were doing that as well. Do you want to cover insurance questions?
Yeah, we get that one commonly. We do not work with insurance because as of now, insurance doesn't cover IV ketamine-assisted psychotherapy. But we will give you at the end of treatment what's called a super bill, and that has all the codes that you would need to submit to your insurance company to get possible reimbursement. And some people have luck getting the therapy portion reimbursed, so some people are able to get some of it back. But yeah, it just depends what insurance you have, if they cover any of it. But that is something that you would have to submit on your own at the end. And then that kind of goes right into pricing.
Yeah, so with pricing, some of our patients, they'll get off a private jet and come to a treatment. Some of our patients are on disability. So obviously, one price does not fit all for a treatment like this. It's a very involved treatment. Obviously, you have a nurse and a therapist and all of these things. But in general, we try to sliding scale the pricing for patients that are of lower incomes or on disability. But the general pricing for our sessions in Austin as of right now are $699 per KAP session, and the medical intake being $150 and integration sessions being $150. In San Antonio, the pricing is a little different. It's $599 per KP, but that's full pricing. So if someone can't afford that price, then they can submit sliding scale pricing where we just ask for a W-2, check stub, and then we can get you pricing that is more adjusted for your income level. We also have an ability to do financing through Care Credit. So essentially, what I always encourage is that if someone's thinking about this treatment, they come and do an intake, make sure that they're a good candidate for the process and not let the pricing stand in the way, because we have a really good track record of seeing the people who are good fits for this treatment, even if they're not able to get anywhere close to that standard pricing that some patients would be able to pay comfortably.
And that form is available on our website under the pricing tab, the JOT form to fill out to see if you would qualify for any discounts.
Well, I'll take administration method. So essentially, we do all IV ketamine-assisted psychotherapy. That's something that we've been, very vocal proponents of since the beginning. That very oftentimes there are clinics that are run by therapists that don't have the same medical backing that we do, or clinics that are much more medically focused don't have the same therapeutic backing that we do. And so for us, we kind of have that blend between, being strong on both sides. So we do IV ketamine assisted psychotherapy, which is fairly rare in the industry. There's not a lot of places that are equipped to do that. Not impossible to find, but very rare. And the reason why we do IV is so that we can adjust that level to whatever would be perfect during a session. So based on that therapeutic goal, we might want a therapeutic level that allows somebody to do better therapy than they would do in a traditional format without ketamine involved, but wouldn't be overwhelming to them or make it so where that they're unable to communicate with the therapist throughout, or just be too much or too little. Essentially, it's really difficult to do with intramuscular dosing or oral ketamine administration. And so that's the method that we use. It's the most studied, it's the safest, it's the it's the type of administration method that allows us to stop at any time or restart or take the level in any way that we need to along the way. And that's something that helps us to just have much less chance that somebody's going to be at a level of experience that's not either, conducive to a ketamine assisted psychotherapy session, or just isn't correct for somebody, that it actually is kind of causing some distress. And so if we are doing IV administration, then we can change that at any time. And so that's why we choose IV ketamine assisted psychotherapy. It's just the best dosing method, and just the best way to do it in our opinion. Now, some people ask about oral ketamine administration for home use. We're big vocal proponents that that's not safe to do. And we don't prescribe any oral ketamine to anybody or intranasal for home use. There isn't any study that ever, proved that administering ketamine in between sessions at home with oral ketamine was any more beneficial than just doing ketamine-assisted psychotherapy sessions themselves. There are essentially only risks and negatives of doing that. It can cause more tolerance when we actually do those ketamine-assisted psychotherapy sessions. So without any justifiable benefit of administering oral ketamine at home, our decision is always to just focus on those ketamine-assisted psychotherapy sessions, as that's plenty ketamine administration to cause that neuroplastic effect that ketamine can provide, and just unnecessary and risky. So that's our administration method.
Another common question that people have is if they have to pause their current medications or if they can continue taking what they've been taking. And generally the answer is most of the time yes. We don't want you to change up your medication routine right before starting a treatment plan, but there are just a handful of medications that we will have people hold just the morning of the infusion. So if you were on any of those, you would be told by the nurse or the nurse practitioner what not to take. There's only a couple things like stimulants, Lamictal and benzodiazepines are the most common ones that people are on that you should hold the morning of infusion. But generally, like if you've been taking an SSRI, other psychiatric meds, we want you to stay on that regimen and not make any major changes right before starting KAP.
Yeah, that's one of the major benefits of ketamine, is it's compatible with most psychiatric medications or most medications in general. So it doesn't require a lot of change in what somebody's already taking to undergo. So one of the things that comes up, patients will ask, can I drive home afterwards? So just like a surgery, we administer an anesthetic medication. It's not safe to drive after. The interesting thing is that in the dose ranges that we give, most patients, by the time that they leave that 2-hour appointment, they're like, I could drive. I actually feel just fine right now. I maybe feel like I have like one drink in my system or otherwise. But people tend to be much more impaired than they actually think that they are leaving. That doesn't mean that you can't take a ride share, but the preference is always to have a family or friend come and get you afterwards and take you home, not anywhere else. So that's.
And if you do take a ride share, we will walk you downstairs and make sure you safely get in the car.
Do you want to cover success rate or me?
I can do it. So the last time we looked at the data, our success rates were at about 87%, which we were using a metric called the OQ45, which is the survey that you'll fill out before each session. You could probably talk a little bit more about that and how reliable that is. But so 87% of our patients at the end of the series were subclinical based on this metric, meaning that they wouldn't even qualify for the same psychiatric diagnoses that they came in with, whether it was depression, anxiety, PTSD. So we have very high success rates, and I think that's attributed to our therapists and how wonderful they are and how good they are at what they do. The ketamine is a powerful, amazing drug, but the real important piece of it is doing the therapy alongside of it, and that's what makes it last and makes it stick. But do you want to talk a little bit more about the OQ45, or do you feel like
Yeah, I
that's
think that
important?
sometimes when clinics are discussing their success rates, you'll see all the time, like we're 85% successful or otherwise. We're trying to kind of set the bar for what that means in the industry. So, how we register success is that our patients are actually subclinical after treatment, meaning that they don't have a level of distress that would actually be indicative that they have a mental health disorder at all anymore. They're not within one of those ranges. And so, that's how we define it, and we try to do that within that initial series. And of course, what does it matter if it doesn't stick around or stand the test of time? Most clinics will use a measure like PHQ-9, which is uh, a metric that was designed by Pfizer essentially to justify insurance reimbursement for patients to get on a medication like Prozac. So it's not a robust mental health measure. It doesn't really tell you whether somebody got better or not, but you'll see all the time online, like 85% of our patients have a 50% reduction in their PHQ-9. For us, that doesn't mean anything. That's not a robust measure. And a 50% reduction in someone's symptoms, for most people, they're like, well, I'm still depressed. So that's not really kind of the standard that we'd like to try to aim for. So for us, we would like the vast majority of our patients to be able to actually have a level of distress where they're not experiencing significant mental health symptoms by the time that they continue a initial series. And then our big focus is that those gains are long term. So our hope is that we can do the therapy that someone hasn't been able to do so far that will stand the test of time, so that they don't just remit 30 days after their initial series as if it was just ketamine infusions only. That's why we focus on the therapy side so much. You want to do the next one?
Sure. So some people ask if they can use their outside therapist for KAP, if it's somebody they've been working with for a long time and are very comfortable with. But unfortunately, it does take particular training to be a KAP therapist. So you would have to intake with one of our own therapists, but we encourage everybody to continue working with their own outside therapist if they've been working with one. And it's good to do a session within 24 to 48 hours after you have KAP with us, when you have that window of neuroplasticity, just to get that extra added benefit. So yeah, definitely encourage people to continue with their outside therapists, but to do KAP here, it would have to be with one of our therapists.
Yeah, patients will ask about that, and the reality is that when we're doing integration from ketamine work, sometimes this integration process, it's something that you need to be trained in to do. So our therapists are trained how to do psychedelic integration, and sometimes it's very confusing to someone who doesn't have that training. So an outside therapist may be wonderful with helping with so many things, and they're very important for all of the aftercare that somebody needs. But during this initial series, some things can come up that are completely normal that might, be sound abnormal to an outside therapist. We have those conversations all the time. And so it's why we collaborate care with an outside therapist. That's why we have our own in-house therapists that are trained in this modality, because they're going to be working with you during the session and helping you to make the most out of all the content that comes up. So sometimes patients will ask about, they'll talk with us during a consult, and then they'll say something like, I'm going to talk to my psychiatrist about doing this treatment process. So, and then sometimes we don't ever hear from them again, after that. So one of the challenges that there is we do ketamine assisted psychotherapy. So a lot of psychiatrists know about ketamine. So sometimes when you mention doing ketamine-assisted psychotherapy, they haven't really heard about that. They haven't really been informed on the differences between the success rates of just doing ketamine administration versus ketamine-assisted psychotherapy. So they might not encourage, or explain those benefits, to somebody. And there are a number of psychiatrists that just didn't learn about it in school. And so when you mention it to them, they kind of aren't as versed on the research. So our encouragement is always that someone comes and does an intake, then we coordinate care with that psychiatrist, and we talk about what our process is, what our dosing is, what our methods are, what our success rates are. And if they have any questions about any of that, then we can send them research that we can do that, education for them to make sure that they understand what our process actually is versus kind of what maybe they've seen at other practices, which not every practice is very robust, or as robust as us. So it's entirely possible that they had a patient that went somewhere else and didn't have, a good treatment process, and they're basing their recommendation on that versus hearing from us how we roll, essentially. So that actually kind of goes into the next one, which is what makes us different.
Yes. So I think we touched on it a little bit earlier that we do titration, which means that we change the rate to dial in the perfect therapeutic level to each person. So a lot of clinics, even if they are doing KAP, they'll just set the IV pump to a certain amount of time, 40 minutes, 60 minutes, and that's the same for every patient. Where, just from being here for several years now, I can't imagine how that's nearly as effective as what we do, because everybody responds so differently to ketamine. And so us having, the control with the pump, having the registered nurse and the therapist in the room to really dial in and get the perfect level for each person it just makes a huge difference on, how well you can do therapy and how effective that experience is for each person. So that would be a big one. Also, just that we do have a nurse and a therapist in each session, whereas a lot of places you may just get an IM injection in the muscle and be left alone in the room. So whenever I do a consult call, I always tell people, call around, do your research, but if there's anything you take away from this phone call or watching this video, is not to go somewhere where you're not supported, because that is the most important factor, that you're not just alone with the ketamine experience. That I don't see what good that does for anybody except for maybe a short-term mood booster. Oftentimes it can make things worse. It can be scary to not have support, to not have somebody to ground you, to have memories and feelings come up and not have anybody with you to process those. So I think those are the two biggest differences.
Yeah.
And I just think everybody that works here is so passionate about what they do and cares so much about helping others and is just really here for the right reasons. And I think that's another thing that makes our patients feel really comfortable and helps them know that they're in really good hands. Anything else you think?
Yeah, I also think the trauma focus. A lot of clinics are, more geared to help people with more mild to moderate depression, and we can see people with very significant trauma histories. Also see disorders such as OCD, complex PTSD, so people with really bad childhood trauma. That's a specialty for sure. And we also have our approach in treating chronic pain is very mental health focused as well, because obviously having a chronic pain disorder can be very difficult on one's mental health. And so if you get a ketamine infusion from a pain management physician, then it's very unlikely to be supported in any way, but certainly not from a mental health perspective. But I think that also we can't really underscore the success rates, because if someone's going to do this process and they're going to invest their time and money, this is an intensive therapy process, the results should stand the test of time. It shouldn't be something that just a month later someone regrets spending the money on, or kind of allocating time for. So those are some really significant differences for us. The intrasession therapy, the ability to converse with the therapist, is so critical. A lot of places are actually kind of averse to doing therapy with somebody while they're under the effects of ketamine. Our therapists are well versed and trained in that. We have some of the best therapists in the world that do ketamine assisted psychotherapy here, and our therapists are oftentimes they work a lot, so they have thousands of sessions under their belts. That's very rare to find. Many therapists, they mostly work as a standard therapist, and sometimes they come and work in a ketamine clinic and support a few people a week. Our therapists do this all day, every day. So that's some real differences between us. But just to kind of sum all of that is just the support, the medical support, and the therapy support. This is a supported process, and if for someone who has trauma specifically, if this process isn't supported, the main thing that I hear when I network with ketamine clinics that just do ketamine administration only is they say all the time that patients will come do one infusion and then they don't come back. And so they have, they get lots of patients in, but they never come back. And that's because they had dysphoric, infusions. For us, we don't have that problem. It's incredibly rare that we ever have anybody who does one session and then that's either all they needed or, that just isn't the process for them. I'd have to think extremely hard to think of a case like that. And so I guess my point is that's not something that we commonly deal with. Our patients actually complete treatment and have success with treatment versus just coming in, doing one session and dropping, either because their dosing was wrong or they weren't supported or for whatever reason. I would also last thing is just the medical support. So we do have the ability to treat people with more significant medical histories. We've seen people who were essentially hospice patients in their 80s, patients that had past histories of heart attacks, strokes, seizures, all kinds of things that many clinics refuse. Patients with significant hypertension issues. We are comfortable with those situations because we have a nurse in the room monitoring you the entire way through the infusion the entire time that can administer a beta blocker if needed or do anything that we need to. And I said that was the last one, but one last thing is we have done thousands and thousands of sessions without ever administering any sedation to any patient. We don't need to because we have therapists and we can control the dosing, but it's actually not uncommon to see in some more medicalized settings where a lot of patients are actually sedated with benzodiazepines during the infusion process, which not only decreases the efficacy, but really makes it kind of impossible to navigate the experience because someone's being sedated. And so if
And they
someone
won't remember any of it.
yeah.
Yeah.
If someone was going to, go through this process to be administered sedation during the actual infusion, almost makes you wonder why we even did it in the first place. So there are places that sedate everybody that they see, and there are places that just sedate when they have dysphoria. But this is just something that we don't do and we don't need to do. And so when we talk with other clinics about how we haven't had to sedate anybody in thousands and thousands of sessions and we never had to do that, sometimes we're met with, that's not possible. I don't know how you all ever did that, but that's because we have therapeutic support and we can control dosing. So I think that those are some really important differences personally. But the main thing that's how you pick a clinic, I would just say is you want to look for IV administration. You want to look for therapeutic support with actual licensed therapists. You want to make sure that the nurse is with you the entire time, paramedic or whatever medical support they have, but they're right by your side the entire time. They can't leave the room or anything like that. So those are kind of the critical elements to me. I don't know if you have anything that you want to mention as a critical element.
No, I agree with those.
All right. Well, if you have any other questions, the phone number is 833-313-2512. You can always email info@transcendketamine.com. Talk with either me or Kelly, and we can go through any question you have from any of this.